Thank you, Ronette. Ms Boland, you were giving evidence about your views on what could be done better in the system to improve preventing children in out-of-home care being sexually abused.
If I could just recap to underscore the importance of robust systems, including policies and procedures that are...
I think we might offer you the microphone.
I just wanted to recap that I think in New South Wales we've obviously had a very long history of continuous improvement in the out-of-home care area, and as a result of that have built progressively more and more robust systems that underpin the child protection system, in particular the out-of-home care system. So I did want to emphasise that the coming together of some of those tools in themselves are preventative, and I referred earlier to the Working with Children Check, the Carers Register, and the interface then with the accreditation system. In relation to, so I think it's a reasonably, it's a good structured system. I think it's underpinned by very good interagency relationships which have grown over a period of time, and increasingly what's becoming more and more important, it always was important, is fine-tuning the information exchange capacities of agencies. So once you have that kind of system in place and that it's child-focused, I suppose that's the thing that supports and wraps around organisations. And then, the accreditation system does look very, very closely at how an organisation responds to children's allegations and then how they respond. The most important thing from our perspective is that we have allegations, that they're dealt with quickly. So the accreditation system, if you're accredited, doesn't mean nothing will happen. In fact, if you have no complaints or allegations, it would be some of concern to us. So the accreditation system operates to assess an agency and their systems and their responses, and how fast they respond, and then how they build that learning back into their policies, practices, and the way they operate their organisation. And I think, in essence, that it's a protective system in that sense, and hopefully over time it becomes incredibly reliable for children and young people. In terms of some of the gaps and I think some of the fine-tuning, I'd say they're now more fine-tuning than gaps and clarification, and as we operate the various regulatory regimes over time, things emerge and we clarify them. And I think some of the more important work, which I think we might come to later, is in relation to information exchange and then how that information is used.
But by all means, deal with that now.
And of course, there is the issue about information exchange between states, and that issue sits there in relation to Working with Children Checks, as you know, and also in relation to information exchange about children and children's assessment and carers.
Isn't it the case in New South Wales that since the amendment of I think it was the Ombudsman's legislation to introduce Chapter 16A, there's been significant improvement about exchange of information?
Absolutely.
Has it solved the problem?
I think some of the solved the problem
within the state.
Yes. Yeah. Look, I think it's. I think over time it's become, quite a robust system. There are we are in receipt of an extraordinary amount of information, and information that we would not have got, say, 5 years ago. So I think at that level it's working quite well. We're still working around the edges of it about what to exchange at what point, and we still have the usual discussions with agencies about why do you want that piece of information or so forth. But that's the normal, kind of discussion that you have.
But what more needs to be done in relation to information exchange within New South Wales to better protect children who are in out-of-home care from being sexually abused?
As I said, I think one of the areas for improvement is information exchange interstate. The bill before the Parliament at the moment talks about not only that information exchange about care assessments being able to be made between state child protection agencies, but also extends that to the Office of the Children's Guardian and to designated agencies. It's subject to a protocol of the Minister together with the Privacy Minister. I think that's a step forward in us being able to receive information and give information. So I think that's in terms of...
Ms. Boland, what was the main driver behind that change?
I think it's always been a gap, and it's always been the subject of, I suppose, interstate and interagency discussion, and various things had emerged. But I think people were reasonably galvanised around some of the work of the Royal Commission, in particular in relation to information exchange.
So in terms of, again, improving the current system in order to prevent, or to the extent we can prevent, do you have any other suggestions for improvement?
No.
Can I ask this question?
I'm sorry.
Ms. Boland, and we've had representatives from the New South Wales Government at the previous hearing, but let's take two issues if I can. There's no doubt at all that the system in New South Wales has, as you say, been changed incrementally, in fact sometimes radically over a period of time, and you've maintained that it's a robust system, and your hope is that it would be a protective and reliable system. So we just take two issues which have emerged this week. What do we actually know in relation to stability of placement, for example? What do we actually know has been the pattern in relation to the stability of placements in New South Wales as a consequence of those systems change, which the young people on Monday identified as a significant issue in their own lives, and we know generally. So what do we know in New South Wales about that? Has there been significant improvements, or do we have knowledge of what has actually happened in that space?
So just to clarify, when I was talking about the robust systems, I'm really talking about those screening systems for carers. In relation to, the system is still has many of the issues that characterise a shortage of foster carers, assessment placements that break down, the movement of children around the system. I don't have the figures about whether those figures have improved over time, whether the breakdowns indeed are less. I suppose all I'm saying in relation to this particular reference is that I think we've got robust systems that would screen people out, and we have another system that looks within agencies to make sure that these things are working.
So as Guardian, would an issue of concern be to you whether or not the systems, including the accreditation system, is in fact delivering, for example, an outcome around more stable placements? Would that be an issue of concern to your office over time? Yes,
it is. And I think one of the issues moving forward, and I think one of the, if you like, a gap or an improvement would be for the accreditation system and I suppose the contracting system to come into clear alliance around outcomes for children and a performance framework around real outcomes for children. I mean, at the moment, we do get quite a lot of data about what's happening to kids in care. Whether you phrase that as input-output data or outcome data, or it probably falls in the former, input-output, with some outcomes on an individual basis. But I think the articulation of what the system is there to do, that is a really real challenge for any system, and New South Wales the same. And I think to bring the the strength of the accreditation system, the strength of a contracting system, and to focus that clearly on outcomes for children is the challenge of the future.
So related to that, and understanding that your office doesn't run the system, that's run by the New South Wales government, just take the sexual abuse issues specifically. What do we know, for example, in relation to the rates of sexual abuse of children in care in New South Wales? Do we have sufficient data and information to know that? Do we know whether it is in fact changing? And does your office that oversights that system have that knowledge?
A lot of the data is maintained, and I'm sure that the Ombudsman will talk about that tomorrow afternoon, but as you know, the reportable conduct system is managed by the New South Wales Ombudsman. They keep substantial statistics in relation to what's occurring across the sector. Internally in our domain, in the Children's Guardian domain, and in the context of accreditation, we certainly look at systems in place for that, whether there is an opportunity and whether there is a need to separately have a look at sexual abuse of children in care via our system. It would probably be something that we would look to do.
Can I be absolutely explicit about it? Do we have the knowledge of what has actually happened to the rate of child sexual abuse for children in care? Do you as an oversighting body actually have access to that information? Or is it a serious weakness within the New South Wales system and other states that we don't have that knowledge?
Are you talking about data, or are you talking about the data?
In other words, the system serves to achieve certain outcomes. We all agree. That's a child-safe environment. And I absolutely agree that robust systems are very important, and we've often not attended enough attention to systems. But at the end of the day, they're about the outcomes that the systems deliver. In this inquiry about child sexual abuse, do you, as one of the oversighting bodies, have knowledge of whether or not there are significant improvements in the rates of child sexual abuse of children in care? And I'll ask the same of Ms Simons. Do we know that? Or is that a gap in our knowledge?
I'd say it was a gap in our knowledge. I think there's indicative, it's certainly data that's held by the Ombudsman, but that's certainly a gap.
Can I just clarify that, Ms Boland? There's the issue of what you know as Guardian, and there's an issue of what other agencies know. That's right?
Yes.
In terms of what you as Guardian know about the rates of sexual abuse of children in out-of-home care, do you have sufficient knowledge for you to say confidently you know the rates?
No.
Do you have any doubt that that information is held elsewhere in the government sector?
Well, I do know that it is held at the Ombudsman's office, and I do know that we exchange that information, obviously for the purposes of working with Children Check, but also for the purposes of our accreditation system. We have, so for example, undertaking, the Ombudsman undertaking inquiries, making recommendations. We've worked with the Ombudsman on those inquiries. The recommendations, we would then put a condition on accreditation that those things are met, and then we would monitor that those recommendations are followed through.
But your understanding is responsibility for that data is with the Ombudsman because of its various functions, including reportable conduct.
Yes, and obviously with the department
So
by
when-
their allegations.
When you
before
refer
the
to
conduct.
a gap, what are you referring to? You said there was a gap. What is there a gap in?
There was a gap in a knowledge about. I'm sorry about whether it's getting better or worse.
So you don't know the answer
No.
to that? No.
But if you chose to know the answer to that, would you be able to find that out? The question
Yeah.
is trying to identify whether or not there is a knowledge gap that exists within the various jurisdictions, and if Ms Mitchell might want to comment nationally in relation to the thing that's at the very heart of this inquiry. And it's very simple. Do we really know nationally and state by state whether or not there has been any significant change in the rate of child sexual abuse of children in care? That's the question. It's clear. And it's not a criticism, it's simply a question. Do we really know that? Whether it's in your office or anybody else's office. And so I'd just like to get a clarity about that.
I can't answer that. Yeah.
Ms Mitchell?
I'm happy to. Sorry, let's do that. There is some data at the national level that indicate the numbers of children out of home care who are abused while they're in care. However, it's not comprehensive across all states and territories, and there are different definitional issues and data collection methods, and so I would say there is absolutely a gap in our knowledge, nor does it indicate accurately who the perpetrator is, nor whether they're in residential or other arrangements. So at a national level, we don't have that picture, nor do we have that picture consequently over time. Little nested studies that are around indicate that, from my perspective, to my knowledge, that there hasn't been a great deal of change in that area.
Do the national framework lead us to a journey that will eventually get us to that knowledge?
I'm very hopeful that that's the case, and in terms of the third action plan, there's an opportunity to further advance the data collection and measurement in these kinds of areas.
Can I just push you a little bit further on that? Do you, as your hopefulness, got a time frame to it? Do you think that within a period of time nationally we will have an answer to the question that I've put?
Well, a number of the measures that have been agreed to already are still not reported on and won't be reported on, and they don't include these measures, and they won't be reported on for another year or so. So in that sense, I think that there is an opportunity to push for that in the development of this third action plan, which is absolutely currently under scrutiny and in development, and I think this is a timely opportunity to intervene and make that sort of recommendation.
Okay, and just finally, Ms. Simmons, do you have any comments on the question that I've raised?
We certainly have information about what gets reported in sexual abuse of children in out-of-home care. A difficulty with that is what gets assessed as being serious sexual abuse is one difficulty. The other, though, at the heart of your question is, are children safer now than they were in the past, and have we got evidence for that? I would like to think that they are safer for all of the measures that we've put in place. I cannot say that they are safer, and I can't say that partly because we're dependent on what gets reported. The majority of children are in family-based care, which is good, but it also means that it suffers from the same sorts of limitations that for all children who are in home, we often won't know the rates of sexual abuse until sometimes decades later. We're doing everything we can to try to ensure that children are safer, so you would anticipate and hope that they are indeed safer. The only data that we have is what gets reported on at the moment, and certainly in our office we have access to that information and some responsibility for tracking it.
Can I just make the comment? It is true to say that if the systems have improved dramatically in the way that all of you have indicated, the expectation would be that the outcomes would be an improved safety for children. The question is really going to our evidence for that assertion.
Yes, exactly. Yes, and it also goes, and you're coming to that as well. It goes to how robust the out-of-home care system is and how it responds to the needs of children. And your questions about stability are at the heart of that as well, because the more unstable life is for a child, whether that be placement change or violence at home or disagreement at home, which results in them having to change placement or move families, makes them more vulnerable every time they have to move. And the more vulnerable they are, the more susceptible they might be to abuse as well. The more likely it is that they would run away from a placement and put themselves at risk. So how we do about the quality of our out-of-home care system is absolutely at the heart of how we protect the children from sexual abuse.
Can I just ask a follow-on question about, it's not so much related to the sustainability or the stability of the placement, but we've heard both in this hearing and in the previous one about the endless parade of strangers that come into a child's life within the out-of-home care environment. Has anyone looked at that specifically as an additional vulnerability that could lead to children being susceptible to influence either later on or exploitation later on? Has that been looked at specifically by anyone?
I'm not aware that we've looked at that specifically. The only thing that I've ever done is sort of count the numbers of adults that might be typically involved in a decision for a child in care, if you like, kind of the co-parenting arrangements that might go on. And it's not unusual for a child to have 20 adults involved in making decisions. That will include professionals and school principals. And so if you think about that for a child, that they're all involved in those sorts of decisions, that's multiplies the numbers of adults, if you like, that the child should have some relationship with. What's so important, though, is that a child who's in out-of-home care has, if you like, the handful of relationships with adults who are trusting and trustworthy and that they can go to. And that's one of the safety measures that we'd be looking at for children who are in out-of-home care. The other issue around stability, if I can come back to that, is the quality of the therapeutic services that are offered for a child who has come into care, either because of the abuse they have suffered before they've come into care, or the abuse they suffer while in care. If we don't make that therapeutic response strong and comprehensive and available to them when they need it, then that inevitably results in increased instability and vulnerability for that child. It's the therapeutic response is not just for the child as well, it is also a response that is for the carers, so that the carers are able to provide the right environment for a child to be able to deal with the trauma and abuse that they may have suffered.
Ms Mitchell, the data you referred to earlier, is that data collected by the Australian Institute of Health and Welfare?
Yes, and through ROLS as well, so, which comes from the AHW.
So the data available to you is that publicly available data?
That's right, and that's come about through the cooperation around the national framework. But it's pretty rudimentary at this stage, and not all states and territories contribute fulsomely, and there are still discussions around the parameters of that data. But that's the beginning of something where we might be able to measure improvements over time. But could I say something about sexual abuse and abuse generally? We don't have in Australia abuse prevalence research. We have administrative data. And so the point that Ms Simmons made about only knowing what's reported is actually very important to make here. So I do believe we need prevalence studies in this country to actually pinpoint the level of abuse occurring for children.
Ms Boland, are you involved in looking at how designated agencies out of home care providers respond to allegations of child sexual abuse within out-of-home care?
We look at the systems that they have in place. When we also have a look at how they've responded and look at some of the issues around those responses.
Is that part of the accreditation process?
That's part of the accreditation process.
Have there been any conclusions you've drawn or observations you can share with us about how those responses have changed over time?
In terms of the reportable conduct system, I think it's been in place now a number of years, and of course I can remember at the beginning about confusion about definitions. I think some of it was difficult assessments that people had to make at the local level. I think that has been simplified, and that people or agencies have got a clearer idea about what they need to report. I'm pretty sure it would be accurate to say that almost everyone knows they have to report. Perhaps, and what we see in the accreditation is often some confusion about the threshold at which they must report, and still some confusion about what they have to report.
Sorry, go on.
So, I mean, I think they're the sorts of things that if we see a pattern of that we would raise with the Ombudsman, and we have done that, and the Ombudsman then has gone in and assisted, or we've done that jointly to look at what the kinds of issues and the remediation that might occur there.
So is it the case that the nature of the issues you've raised with the Ombudsman concern confusion around what to report? Confusion about the threshold at which you report, and also that there isn't, some things haven't been reported that should have been reported. Haven't been reported because of a deliberate decision not to report it?
I couldn't say whether it was deliberate or not. Maybe it's more likely to be oversight rather than deliberate. That would be our observation. I'm not saying that there mightn't be a person who deliberately doesn't, but our observation is when we see that, it's been in the context of either organisational change of staff, those kinds of organisational occurrences.
And if there was a systems issue that you or the Ombudsman identified, that would be the subject of discussion with the agency concerned?
Yes. Yes.
And if it was organisational change, that would also be discussed with the agency?
Yes.
Just looking at organisational change and governance, is that an area of particular note in responding to allegations as far as your functions are concerned?
As I said before, organisational change has an impact on their capacity to maintain, obviously, the systems that they've got in place. So that's why for us it's a trigger to go and look to see and make sure that any of the risks that occur in relation to those changes are covered off and managed well. So I think in the area of allegations, that would be one that we look at when we go to agencies.
Ms Simmons, do you, in your role, have any responsibility or oversight of how organisations, designated agencies or others providing out-of-home care in your state respond to allegations?
Not directly, no. It's not. South Australia is a smaller state, so generally we know the agencies which providing services to children in out-of-home care, some to a greater degree, some less, but we don't have a formal responsibility for looking at the way they would respond to allegations. But because we do monitor the progress of investigations and we can ask for the reports of investigations, if we were alerted to an organisation where there perhaps was something lacking in their response to an allegation, we would then contact the department who has the responsibility for monitoring child safety or child safe environments, it's called in the legislation. We would have then contact the department and alert them to our concerns about an organisation.
Are there any observations you've made over the 10 years that you've been in your position about any changes in institutional responses in the out-of-home care sector when an allegation of child sexual abuse has been made?
My observation is that people are paying a lot closer attention to it. If anything, from public hearings such as this one and a focus on what has happened in the past, agencies are taking their responsibility for responding a lot more seriously, and not just responding but believing children when they do disclose. So if anything, my observation at least is that we are doing a lot better as a whole in responding to allegations of abuse.
You referred earlier to a therapeutic response to children and carers where there's been an allegation of abuse. In South Australia, are there services specifically for children who have been sexually abused, leaving aside the institutional context for the moment?
There are the provision of mental health services for children, regardless of whether they've been abused while in care or before coming into care. We did do an audit in 2011 of looking at the provision of mental health services to children who are in out-of-home care. Can I just refer to my notes about that?
Certainly.
We looked at 60 cases, were examined in detail. The question we were asking is what is the unmet need in relation to mental health services? There was the majority of children and young people who needed a mental health service received a service. However, there was unmet need because of delays in receiving the service and some neglect or obstruction. 6 of those 60 children had never had a mental health care assessment done, so their needs were unknown. 5 who were assessed as requiring mental health services had not been referred to a mental health service. Of the 54 who had an assessment done, 40 were recommended for a mental health service and only 35 received a service, so that's 87% of those who had been recommended for a service received a service. However, the median wait from the time of the recommendation to their first appointment for a service was 5 months. So it's not that the services aren't there and the intention isn't there to provide therapeutic services for children who have suffered abuse and trauma. There are certainly some issues about the engagement, the time of waiting for children for a mental health service, and sometimes the length of the therapeutic service that's provided.
Is there any priority given in South Australia, in the health sector, for children who are in out-of-home care?
There is, yes.
And so the 5-month waiting list you referred to is 5 months for children in out-of-home care who are up the list anyway?
That's right, yes.
Ms Boland, the same in New South Wales, isn't it? That
yes.
The health sector gives some priority to children in out-of-home care?
Yes.
From your role as guardian, what's your knowledge of the availability and adequacy of therapeutic services to children who've been sexually abused?
From where we sit and we look at the service system, I mean, in New South Wales, the services are available, it's accessibility again, and the waiting times. So I think it's a similar pattern, a similar situation.
Thank you. Ms Mitchell, is support for children who have been sexually abused part of your remit?
Well, anything that is about the rights, anything relates to the rights of children is in my remit, and indeed the Convention on the Rights of the Child specifically refers to the need for states, as in governments, to provide restoration and rehabilitation for those children who've been abused. In my experience, working in child protection systems, it may have improved because it's a few years now, but my experience is that these are specialist services, that they are very much in demand, those that exist, and that they are hard to get. And for instance, in the ACT, we would often have to bring people in from New South Wales to assess and provide counselling and therapeutic support to children, and often with lengthy delays. And I would say again, from a measurement perspective, it's not something that we regularly measure. There are some measures about counselling being offered to children, but nothing really, in my knowledge, about the quality and whether they received it and what the quality was and the impact of those services on children's wellbeing. So for me, that's a very important measurement gap that we have in the service system.
Are there any other gaps that you can tell us about in relation to children in out-of-home care who are at risk of or have been sexually abused?
I think there's, in terms of a system response, and we were talking about therapeutic support, I think that a number of the commissioners and guardians would want to raise the issue of a lack of professional foster care for children, in that many of the children that are at highest risk and that may be risk-taking themselves in their preteen and teen years require one-on-one professional and therapeutic support, which they usually don't get. Many of them end up in these residential environments where they're actually at additional risk. So I think that is something that all states and territories need to be looking at to improve the availability of professional foster carers. It's
professional foster carer meaning?
A foster carer who has a higher level of training and ongoing training, who has certain qualifications, may come from certain disciplines, and who has access to 24-hour therapeutic additional support, psychological and other supports, and who is supported to help to be part of a team which is, in a sense, administering a program of therapeutic care over a period of time, but in a family environment. So there are a few of these around the country, but not many. There are some in New South Wales, and there may be some in some of the other states and territories too. They are also paid a higher wage than the normal remuneration for foster carers. It's a very common phenomena in many overseas jurisdictions where it's recognised that certain children need additional skilled and supported support. There have been in the past some potential impediments to the growth of this kind of care arrangement, including perceptions about taxation issues, and which the federal government has looked into from time to time. And there is actually a report that they commissioned a couple of years ago that sets out all the barriers and opportunities in this area, but we're yet to have a solid national conversation about how we can grow that type of support system for kids.
Ms Boland, are there any additional gaps or strengths that you wish to draw our attention to in this area?
I certainly agree with Megan on the professional or therapeutic foster carer. I think that is something I know that is exists in New South Wales and certainly has had some very good outcomes for kids, but it is that one-on-one intensive care that's required, and I think the default sometimes is to place them into residential facilities where those behaviours and the therapies available to them are not as robust as they could be. The department does run one large, it's more than 8, residential facility, which is quite an intensive facility with step-down services, and that has seen some success from a model perspective, but certainly increasingly children's behaviours, young people's behaviours are escalating. And I think the earlier that those kind of therapeutic interventions can occur, obviously the better the outcomes will be in the longer term. And the essential, it's a complex problem about children revealing sexual abuse and the facilities that are available to them at that point, and then the therapy that's required afterwards and the follow-up, and it isn't just a couple of sessions, it's an intensive relationship over a period of time. So,
thank you, Ms. Boland. Ms. Simmons, dealing firstly with the professional carer issue.
And the question is whether we do, or whether I agree that is something that is lacking. Absolutely, that is something that should be dealt with, certainly on a national basis, because a number of the obstacles are to do with taxation and industrial issues to prevent it from being fully implemented. So that's certainly over time or overdue that we should be looking at how we can introduce professional foster care across the nation. In relation to gaps, I'd probably point briefly to 3. I think one is around the depth of training that is provided, particularly for carers and workers working with children with disabilities, and for those who are showing obvious signs of distress from trauma and abuse. The second area is what sort of regular visiting should there be for a child when they're in out-of-home care by an independent person or an advocate for the child. And the third area I think that we have yet to resolve is what is the best response to child-on-child abuse. And the reason I say that, I think we're all struggling to cope with that, is that a criminal response to it is only part of the answer and is highly inadequate, and a therapeutic response is only part of the answer and also is highly inadequate. Neither of those two on their own are the right response. So somewhere we've got to be able to get to something which is saying it is not okay, it is unlawful, but secondly, what is it that we do to help both the victim and the perpetrator in these circumstances? And there's a number of things in the system that we still have to do around what we should be doing there. Just starting, first of all, just with placement matching, that we have a system of out-of-home care that is robust enough that children have choices about, or adults have choices about where they place children, is terribly important. The therapeutic response is in depth enough for those who have sexually aggressive behaviours as a result of their own abuse, that you might need single child only placements for a period of time while that child is going through therapeutic services, and that be available to them, that you have really strong case management for children as well. They're the sorts of systemic things that we need in place to make sure that we're responding well to child-on-child abuse, and there's some of the gaps that I would point to.
Ms. Boland, child-on-child abuse is described by Ms. Simmons. Is that something that's come to your attention in your role?
Okay. Yes, obviously it comes to our attention, via the accreditation system, and there's been I reflect Ms Simmons's comments about the difficulty in the police response versus the therapeutic response. There are some services that deal directly with sexual offenders and sexual peer-on-peer sexual abuse. They look at behaviours and as to their success, I think we still don't know about their success, but certainly it is a difficult issue that everyone does grapple with about whether you leave it to the criminal justice system or indeed whether it has a different nature and texture, which I think it does, and should be dealt with more in a therapeutic framework and a behavioural framework.
Thank you. Thank you, and I have nothing further.
Thank you. Can I just pick up a couple of matters that have come up during the morning's discussion and perhaps start with you, Ms Simmons, with respect to your comments about one of the roles of your office is to monitor the circumstances of, or monitor children and young people in out-of-home care. And I think what we've heard from all of you is the importance of hearing the voice of children and young people directly. So my question is, how do you do that?
We're a small office and there are 2,600 children and young people in out-of-home care. So we very much see our role as encouraging other agencies to do that. And so we have to demonstrate how it can be done. So I am getting to answer your question about how we do that. But I start from the belief that everybody has to be doing it. So we have to encourage and ask and demonstrate how it should be done. We do that obviously in a proactive way by visiting residents who are in residential care. We talk to children who call our office. We have a participation strategy in the office, which means that we will go out to consult with on a regular basis with children about particular issues. In legislation, we're obliged to have a youth advisory committee. Our experience with the committee is it's much more of an informal process, works a lot better than a formal process. So we use our active consultation with children and young people now to be fulfilling that committee role, where they can raise issues that they want to with the Guardian, but also we will be consulting with them on particular issues that we want to hear their views about. In fact, a few months ago, we talked with 35 young people about their views of and experiences of the child protection system in general. So that's the sort of things we might be able to do to encourage children to talk directly to us. But from my point of view, most importantly, it is demonstrating that it can be done, so that other agencies do adopt that. The other way that we monitor the circumstances of children is that we attend 10% of the annual reviews panels, if you like, of children who are under long-term care and protection orders. And part of the reason for us participating in that, apart from auditing the circumstance of the child and how well the review is conducted, is to encourage that the child has a voice in that process.
So you mean like the case planning meeting?
Yes, but it's a little more. In the legislation, they're required once a year to review the circumstances of a child, and they're required to bring together a panel of people. Our preference, of course, is that the child be present, but if that's not possible, that their voice be directly heard in that annual review. That is, that their views have been sought and are represented at that annual review. So part of our auditing process, if you like, is to encourage, in this case, the Statutory Child Protection Agency to also be actively seeking the voice and views of the children in every decision, important decision that is made that affects them.
How do you think that's being done at the moment?
It's not being done that well, but I have to say that it has improved in the time that we've been monitoring. So it's still In terms of direct participation from recall, it's still only at about 25% direct participation, and that doesn't mean that the child, 25% of the children attend, but that they may have given their views in writing, or that somebody is directly representing what they said in answer to questions. Now, the introduction of the Viewpoint electronic survey system, which is being introduced across the nation as far as I know, will be a great boost to hearing directly from young people about their views of their circumstances. So in answer to your question, we try to demonstrate and model how it can be done in listening and talking with children and young people. We also generally, if children and young people ring in, or if somebody rings in about a child, if the child is old enough to provide their views directly to us, we generally require that we will talk to the child rather than go through the intermediary, as long as the child is comfortable in talking with us. And again, that is saying to people, we need to hear, and we can hear directly from the child and their views about this, and this is how it can be done.
Thank you. Do you want to comment on that too, Ms Mitchell?
Yes, I would concur that that is another, I think, achievement of the Framework for Protecting Australia's Children, is the commitment to a national survey of children, and we will get the first results of that fairly soon. And then what comes out of that, a number of the out-of-home care, the indicators for the framework will be informed by what comes out of that survey. For instance, there's one of the indicators relates to whether children feel they have a say in decisions that affect them. It's a start. It's not a great deal of information about what we know about children's participation in these systems, but it's a starting point, and so it will be very valuable. Could I also say, as part of the consultations for this third action plan for the framework, I work with the department to facilitate some consultations directly with children and young people who are in care, and that's the first time that's happened as part of
Do you mean
process.
The departments, the various departments?
The national department and some of the non-government agencies that participate in that process. So that is a really good development, and one of the things that came out of that consultation was the importance of embedding those sorts of consultations with kids and young people into the ongoing development of the discrete actions, because they're the experts in their lives, they're the ones who have the information about how to improve the system, and it's also incredibly empowering for them, for children, as we know, that are quite disempowered by what's happened to them in life. So it's a good capability building initiative as well. So that is a good development, and if we can embed the idea that talking to children as the consumers and clients of these various systems is normal, natural and beneficial, I think that will be a great achievement in terms of cultural change that we've been talking about before. We need to make that the norm. The last thing I just comment on, there are a couple of initiatives that I've been involved with as National Commissioner that go to my reporting function but also have relevance to children in care. The first is, in my report last year, I investigated through a public submission process and a range of roundtables and sourcing original data the issue of suicide and self-harm among young people under 18, and and as part of that investigation, it became clear that children and young people in the care system are particularly vulnerable to self-harm, and for all sorts of reasons, because they're exposed to many, many risk factors, including sexual abuse. And this year, and kind of as a consequences of that work and coming out of that work, but also because there's a broader national conversation going on, I'm looking at the impact of family and domestic violence on the rights of children. Now, obviously, a number of children in the care system are in the care system because or it's one of the factors is domestic violence. They're either victims of it or they're exposed to it. And I note that you were hearing from some experts this week who drew a direct link between exposure to domestic violence and sexual abuse. And so hopefully from that work as well, there'll be recommendations about prevention and responses as well that might help you in your considerations.
Thank you. Ms Boland, do you want to come in on this and add anything from your perspective?
I mean, from our perspective, we do look at how the agencies hear the voice of children. So that's our role, to look at their systems and have a look at the initiatives that they have in place. I suppose from our child safe work, we have done some work. We do quite a lot of work with agencies who talk about the need for material to identify sexual abuse, in particular grooming. There is a lot of confusion and I suppose anxiety amongst people in identifying what's grooming. And so a lot of our education and training does group around what is sexual assault, what is grooming, and then the systems there for report, but there is certainly a level of anxiety. On the other hand, people also express that they don't feel comfortable or don't have the resources available to them to talk to children about what is safe and what is not safe. They report that they need some guidance on how to speak to children when sexual abuse has occurred or is alleged to have occurred. And they need something to give to children about who do they tell. So we're working in that area to develop some, we hope, useful resources for people to use and useful resources for children with clear messages. One of the little programs that we have at the moment is being as safe as I can be, and having a group of people that they know that they can talk to, so we call it the group of 5. I know that schools do similar things with their pastoral care. They have more than one person that a child can talk to. They might have 2 or 3, and they're identified, and it's very clear when things happen. We did a survey of children and young people about who would they tell, who do they feel comfortable telling, and did they know what they had to
Is this
tell?
with respect to children and young people in out-of-home care?
This is a general, but certainly the work that we've done previously in out-of-home care is reflective about who do they talk to and who would they like to talk to, and again, it's age-specific, but it's not just one person. They refer to a number of people over the course of a journey of their life and their time in care.
You would have heard from the young people who gave evidence before the Commission on Monday that each of them identified the need for a trusted relationship to be able to talk to that person about bad things that are happening to them. That is reflective of what commissioners are hearing also in private sessions from people in out-of-home care placements over the decades, and I don't think it's an observation or information that would be a revelation to any of you. The question is what's being done about enhancing and maintaining or providing that trusted relationship to children and young people in out-of-home care. Can I start with you, Ms Simmons?
The most important relationship they can have, of course, is with their carer, if that's safe, and that and that's the one that you, if you like, you want to support and maintain as long as it's safe and good for the child to be there. The second, when we talk to children about their views of their social worker, for example, one of the key things that came through, firstly, was how significant the relationship was with their social worker, but secondly, that they did see them as a measure for safety. So they viewed that the relationship that they had with their caseworker was very important for their safety. If you move to the next level, that which might be then there'd be another level of those children who are involved in the child's life and should be looking out for them, which might be the teacher at school or somebody in the health service or a mental health service. So there's also professionals who have a role in ensuring a child's safety and should develop a trusting relationship with the child. But the fourth area, which is the one we have been talking a bit about today, and that is what role for an official visitor whose only purpose is to visit once a month to talk to the child about how safe they feel or what's bothering them or how good they feel about. But they're very expensive if you're going to operate it for every child who's in out-of-home care, and in some circumstances the child may resent it as well if their circumstances are such that they just want to have a normal life without having somebody visit them every month to ask how they're going. But the model that I favour is one where you have community visitors appointed for the first few years at least of a child's time in care, because that tends to be the period of greatest instability for children, is in those first few years when there's a court process often going on, and so children are often moving from one placement to another, and there may be an emergency placement for a time. If you've got one person who is visiting them every month, regardless of where they are, and that child knows that they're seeing that person every month during that time of instability, possibly being returned home to their family and back out again, then you would hope that at least over that period of time, 18 months to 2 years, that they develop that trusting relationship with that visitor. So if they did feel distressed, uncertain, had questions that weren't being answered, that they could ask that of that visitor. If there were also periods in a child's life where they became more unstable, you might want to appoint a visitor again for that period of time, even if it was later in life. So I acknowledge that having a community visitor program that is forever for the life of a child from 0 to 17 may not be the best way of going, and it's also very expensive. But we should at least look at times when children are likely to be most vulnerable in relation to stabilising their circumstances and their permanency, and possibly be looking at having an advocate for the child during that period of time.
Ms Mitchell, do you want to comment on that?
Yes, I think it's a very interesting point that the young people raised, and it's something that's been raised with me when I talk to young people too. And I do think it's about getting the nuances right about what that person would be for and what they're not for, what they can deliver to the young person or not. And I was talking to Kate, who you talked to on Monday in the break, and she is part of a kind of organic kind of youth group in the Bendigo area where they've kind of developed a network of young people. So it mightn't always be a one-to-one person that young person needs. And indeed, there's another a similar initiative in the Northern Rivers District in New South Wales, where young people from different agencies have got together. And in fact, Kate was saying, actually, if we had to sit down and raise this stuff with the agency, that's not always going to work for us. That's going to be a rate-limiting step. And kids have said things like in consultations that they need to talk to someone outside the family who they can trust, someone who's neutral and won't take sides. And another from one of the forums, when workers hear from a child that something has happened, a whole path opens up. Some kids don't say things for fear bad things will happen. So I think it's really important to understand exactly when you're just having a conversation and when you're going to get something happening in the system that has consequences, because they have very tenuous relationships anyway, some of them, and then to jeopardise them is what they think, puts them in a very difficult space. So sometimes they don't want to speak up to the carers or even the social workers, because they know that everything's going to fall apart again. So how we can get everybody in that space more supportive of the child and give them and set up sometimes informal, sometimes formal other options for kids. And I wouldn't be prescriptive about it. I think it's different for different children, as Pam has said, depending where they are in their experience and in their journey and what they want. But I think the best thing to do is ask them.
Commissioner Milroy.
I have one specific question for Ms Mitchell. With the National Survey of Children, is there going to be an Indigenous cohort within that?
I can't recall offhand. Could I get back to you on that? Yeah. I do recall that this was discussed, and maybe one of the other commissioners has more intelligence on this and can answer this question in the afternoon. Yeah. But I will get back to you on that.
And my second question is a more general question to the panel. We've heard a lot about the need to have the voices of children heard strongly, and we've also heard that children going into care at a younger age and for longer. So has there been any innovation or difference in the advocacy model for the under fives? It's a much harder group to sort of try and represent.
Just on a general, for children generally under 5, I was one of the things that the United Nations Committee on the Rights of the Child has commented on about Australia and many other countries, but Australia in particular, that how inadequate our capacity to engage with younger children under 15 and in early childhood spaces is, and I think that's still the case. I have been doing some work with the early childhood sector around children's rights and practical ways to listen and listen to, engage with and support children's rights in those early childhood settings. That kind of work could easily be extrapolated out to for kids who come into the care system and in particular those who are living with who have had traumatic backgrounds, but that work hasn't been done to date, and I think it's another gap that you identified.
I think people think that children under 5 can't give their views, and that's not so. Children under 5 can, and I think we have to get more skilled at being able to do that, as Megan is saying. So there are a lot of things to learn from that. The other thing that adults can do, of course, is learn to put themselves in the position of being the child who's under 5. And I don't think we're very practised yet at doing that. And that is adopting the perspective of the child, how that child would be feeling in these circumstances. We tend to be so focused on the adult noise around us. So if, for instance, if it's a child who's going through a court system of whether or not they should stay with their family, the loudest voices, of course, are going to be adults in there. What we've got to make sure is that at least somebody has the sole job in that of putting themselves in that child's shoes, but being able to adopt the perspective of that child, regardless of their age, as an infant, whether they're 2 or 3 or 4 years of age, to be able to then say, do you imagine how this would feel for this child? So if you're asking about advocacy, that's the very important role that we can play, regardless of the child or young person's age or ability, because there will also be a number of children with disabilities who may not be able to tell us what it is that their views about something. But we should be able to put ourselves in their place, and we've got to get more practised at doing that.
Commissioner Fitzgerald.
Just one very last question to Ms Mitchell. It's to do with the issue of the Commonwealth Government. And given you're the only one representing the national scene, can I just ask this? What is the role of the Commonwealth Government in this space going forward? We understand they take a leadership role in the national framework for protecting children. We understand that there are matters that we will attend to in the Working with Children's Check paper, which we will release shortly. But beyond that, is there a role for the Commonwealth Government going forward in the out-of-home care space, or any aspects that we've been talking about?
I think there are a number of matters where we've discussed that could have a greater or lesser role for the Commonwealth. and there will be people putting forward views to you about that. In areas like information exchange, in areas like reportable conduct, for instance, there may be areas where it makes a lot of sense and it's efficient to do something at a national level, or at least take leadership in the area of national consistency. And already there are those sorts of initiatives are attached to the national framework. For instance, in the area of the Working with Children check, there is work going on there already, and the Commonwealth Government is playing a role in that. There are also institutions that have a role in terms of the welfare of children that are Commonwealth institutions. There's like the Medicare system. When we're talking about priority of access, for instance, for children in care, there's the income support systems, and there are protocols in place around those two systems already, and I think that can be enhanced further. And of course, in the area of information exchange, it is absolutely critical that the Commonwealth Government plays a key role in overcoming the perceived privacy barriers to exchanging information across state and territory borders. And it's a good initiative that's happening, and probably, as Karen said, in part because of the work of this Commission. The Commonwealth is also leading, and along with the states, work on the national plan for reducing violence against women and children. And these two plans and frameworks aren't unrelated. And so getting some synergy between those two national strategies, I think, is pretty critical. And in fact, over time, I would like to see the Commonwealth support a national children's plan for this country, where we can look at the needs of all children, but in vulnerable groups in particular, and that has an ongoing life beyond this national framework, and that sets the scene into the future. But that's high on my wish list, and I'm hoping to put it on other people's wish lists as well.
Thank you.
Just one matter, Your Honour. Ms Simmons spoke of various statistics and provided us with a representation of those statistics. And in that document, there's a reference to CRC. What does that stand for?
My apologies, yes, that's a South Australian term. No. Sorry. It refers to a term called community residential care, which is actually the large units. I should have changed that on the graph, so yes, that's what that is. And
a list of the products which are available for children in out-of-home care. I tender those two documents, Your Honour, and I'm told we're up to 24.3, Exhibit 24.3.
Thank you. I'll mark that as Exhibit 24.3.
Thank you, Your Honour.
Otherwise,
nothing further. Thank you.
Panel. Thank you very much to the panel. Thank you for your attendance and participation in the Royal Commission. And I understand we've got a new panel at 2.
We do, Your Honour.
Thank you.